What is the difference between a specific technique and a non-specific technique? I think you're going to have a look at this, aren't you, Alan?
Yeah, great. It's a good question, isn't it? Let's start with specific techniques first. Specific techniques are designed to deal with a specific problem. Let's say, for instance, someone has a frozen shoulder. You have a particular technique which you apply, the idea being to unfreeze the shoulder. You might have someone with migraine headaches. You have a technique that you apply for people with migraines, with the aim being to stop them having the migraines. It's quite a specific thing. Now, that's great, but the only problem with that is you have to have a technique for every different problem or ailment people turn up in your practice room with. Because if some people come up with, I don't know, maybe they've got some kind of inability for their respiratory diaphragm to work as well as it might do. Now, if you don't have a technique that works on diaphragms, you have to say, well, I'm terribly sorry, I don't have a technique that works on diaphragms. You need to try this person or that person. Now, non-specific techniques, they don't really treat any conditions. And what they do is enable the body to follow its own priorities to resolve those issues for itself. So actually, it's a much, if you think of all the techniques as tools in your toolbox, a non-specific technique is a big Swiss Army knife. You know, there's lots of things it can do. And in fact, CPA is a non-specific technique. Now, when we are conceived, we're a single fertilized cell. And in just 9 months, that will turn into a fully functioning human being. And the force that guides that development, which we call the innate intelligence, innate just means what you're born with, really. You don't have to acquire it. That force, once you're born, doesn't go away. It continues repairing yourself, healing, metabolizing new parts, turning the cheese sandwich you had yesterday into eyeball cells tomorrow. All those kind of factors are still going on and governed by the innate intelligence. And in fact, the innate intelligence has its own priority, its own agenda of what it needs to do to keep the body well. Now, a non-specific technique like CPA, all we're trying to do is to remove the impediment to that innate intelligence expressing itself more fully. So you don't actually need a different technique for a frozen shoulder. You don't need a different technique for a migraine. You don't need a different technique for a diaphragm issue. If we can reduce the gravitational challenge on a recipient, it frees up their internal resources so the innate intelligence can then use it as it sees fit to repair itself. So let me ask you a question to demonstrate this. Think about your liver at the moment. Just tune into your own liver for a moment. Now, all the thousands and thousands of processes that are going on in the liver at this moment, just as you're sitting here, do you know what your liver needs to be doing next? Well, if you do, give us a ring. But really, you don't consciously, you don't know what your liver needs to be doing next. So if someone comes into your practice room with a liver issue, how on earth are you supposed to know what their liver needs if you can't even know what your own liver needs? However, your innate intelligence knows exactly what your liver needs. Also, your recipient's innate intelligence knows exactly what its liver needs. So if you can just do a CPA alignment, remove the gravitational challenges, free up the resources in the recipient, then the recipient's innate intelligence can get on and do the job it was designed to do. It's fantastic. Do you feel the need to add anything to that?
I do actually, because I think as therapists, particularly if you've been coming from an angle where you've got a tool for a particular problem, so you're working in a more specific way, then you're used to the idea of saying, okay, the body needs to do this, I need to do this to the body to get that result. And we were in a similar position when we first came across CPA a long time ago. Being chiropractors, we would look at the body and say, yes, the body, we need to do this with the pelvis so that the body's more aligned here. We need to do this with this vertebrae, this with the knee, just to get the body into a better position so that the person felt like they were having, having some effect. So we were sort of deciding what the body needed to do. We were using our own judgment. We were allowing our ego, if I dare say, to come into play here. So when we learned core postural alignment initially, it was quite difficult really to sort of just allow that idea that the innate intelligence would decide what was the priority that needed to be treated. So we had to stand back and just, how do you put it?
Oh,
So you
yeah.
say,
I have this little phrase. We need to humble ourselves before the wisdom of the body,
yeah,
and just facilitate that to do the
yeah,
job. It's not us, it's there.
yeah. So over the years, we've seen lots of examples of people coming in with particular conditions. And, you know, when you're doing the medical history, you find out about other areas of the body that perhaps are not working as well, but they don't mention that in their initial sort of summary of why they've come to see you, because generally they come in because they've got sort of a musculoskeletal type of problem. But they don't forget to tell you that they might, that they don't forget to tell you, but you find out that they've got a digestive problem. So they come back the week after, the musculoskeletal problem is just the same, but the digestive problem is resolved. And it's like, well, in their eyes, they think it's not a result. But in our eyes, we need to re-educate them to show them that this is what the body needed to do to release the energy, so that hopefully then what they're going to do is to deal with the condition that they've come to see you with in the beginning. I've had, when I was first in practice, I had quite a bizarre sort of reaction, really. Somebody I'd been working with for quite a while who had a stubborn sacroiliac joint, and I just had every 4 or 6 weeks they would come in for a treatment and we would adjust the sacroiliac joint. They'd come back 4 or 6 weeks later needing it to be done. The first time I did core postural alignment with them, I was working in the sort of neck area doing the neck moves, and she had this almighty crack in her lower back around the sacroiliac joint. I sort of held my breath and thought, oh my God, what's happened here? She got up, she felt great. She came back in for her next session. Her sacroiliac joint had resolved, but most startling for her was the fact that that same night when she got home after having that alignment, she started playing the piano. And what she remembered was she stopped playing the piano around about the time, and it had been like a long time before, she had this accident and started to have this problem. It was really bizarre, the sort of link between what how her body, innate intelligence was working. It sort of takes me back to the Adam Cadman. Her potential, as far as her creative potential, had been stunted a little bit. So using core postural alignment here in its non-specific technique allows the body to do all sorts of wonderful things by that reconnection.
Yeah. I know I had a lady early on who, when she came back in for the second appointment, I said, have you got on? She said, well, do you know, I just forgot to smoke till last night since 3 months. And it's like whatever smoking provided for her innate intelligence didn't need to be provided by the smoking anymore. And so who knows what that was? You know, I'm just grateful that the innate intelligence knows what it's doing. Yeah. So expect wonderful.
Yes,
wonderful
that's
results,
just what I was going to say. It just, well, be open for the unexpected, and listen for the unexpected, because sometimes it'll just be a passing comment and they won't necessarily see it as being significant, but it will probably be significant because it could be something that changes their lives.